What are the treatment options that are available to patients that are diagnosed with prostate cancer? Over the years, we've seen an explosion take place in a variety of treatment modalities for prostate cancer. Traditionally, surgical intervention or radiation therapy has been used primarily as the most common modalities to treat patients that have had prostate cancer. But as we've learned a natural history of prostate cancer, not all prostate cancer is the same. For example, there are patients that develop prostate cancer that may never have any long-term sequelae from it. And these patients are now good candidates for what we call active surveillance. In other words, we can follow the cancer, not intervene surgically or with radiation, to preserve the quality of life that patients have right now. In patients that have had a modality such as radiation that have failed treatment, we can either surgically go in and remove the prostate. For patients that have had surgical intervention, we can go in and radiate those patients postoperatively. We can also freeze the prostate, or cryoablation is a modality in which we can bring the temperature of the prostate down to minus 200 degrees or so, freeze the prostate, and kill the tumor cells. So there's a variety of treatment modalities that are available to patients. The problem is making the right choice. And the way one makes the right choice is to sit down with their physician or physicians, talk about the options, talk about the benefits, talk about the weaknesses, the strengths of the various treatments, what the long-term risks are of complications, and then one's able to make a final choice and then be treated, and hopefully be treated in a successful way such that there are no long-term complications or sequelae that develop. The goal of prostate cancer surgery is to cure the patient of their cancer. Whether it's surgical intervention, radiation therapy, or whatever, the goal is to preserve the quality of life and cure the cancer.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.